Okay, so I just want to start by showing why I could not get the slideshow to record. For some reason, I'm thinking it's because I've got a Chromebook. The record slideshow does not show up for me. I've tried downloading PowerPoint onto my computer and everything, and this is my only option with a computer. So we're going to go ahead and start. In this slideshow, I'm going to be talking about an interstitial lung disease known as rheumatoid arthritis. This is a picture I added in here just because it helped me with basically categorizing it as an interstitial lung disease, and it falls under the connective tissue disease. It's not something that like black lung or something like that is caused by an exposure to a toxin or something like that. What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disorder, which means that the immune system sends antibodies to specific parts of the body even when it's not needed, and those antibodies attack those tissues as if it is a foreign body or something like that. This disease is also a chronic inflammatory disorder, mainly because, just like if you cut your finger or something like that, or sprain your ankle, you get inflammation, and that's because your body's trying to heal that process, and that inflammation is caused by that immune response. Here's a picture of what rheumatoid arthritis, what normally people think of when they think of rheumatoid arthritis. Clinically, if a patient has rheumatoid arthritis, you can kind of see, if you look at their hands, this is commonly what they will look like. Sometimes it can be worse, sometimes it won't be as bad as this, but this picture just kind of shows you that. Rheumatoid arthritis can affect the lining of the joints. So, just like we said in the last slide, the autoimmune disorder will send those antibodies down to the lining of these joints, and it basically just destroys this tissue there. That can cause bone erosion, because once that tissue is destroyed, obviously the bones are going to rub together, and once those joints are messed up, that can cause the joints to be deformed. Etiology. From the research that I've done, the cause of rheumatoid arthritis is unknown, other than the fact that it is an autoimmune disease. Some risk factors could be genetic. There's some evidence that shows that, but it's very small. Hormones. The only reason that they think hormones may have something to do with this is because women are more commonly have this than men, so they think maybe that could be due to hormones. And then smoking. There is some evidence that smoking can increase your chances of getting rheumatoid arthritis. Here's a picture just to show how the scarring caused by the autoimmune disease can affect the lungs. Here's a picture of the lungs. Zoom in on the bronchioles, and the capillaries are the red and blue. And then over here it shows how when rheumatoid arthritis affects the lungs, it can affect that interstitial tissue just like it does the joints and the fingers, and that can compress on the alveoli. Therefore, if the alveoli cannot expand like they need to, less oxygen can be consumed. Okay, so just like I just talked about, whenever rheumatoid arthritis affects the lungs, basically the immune system sends these antibodies down to the lungs, and the immune cells collect in the lungs, which can thicken that interstitial tissue, and that leaves less space for the alveoli to expand. And that can cause, basically, it's a restrictive disorder then. Some clinical presentations of rheumatoid arthritis could be shortness of breath. If the patient is hypoxemic due to all that scarring in the lungs, they just can't get enough oxygen. That can cause them to be short of breath. Chronic dry cough, kind of the same thing. Whenever the alveoli are compressed like that, that can kind of lead to atelectasis. And one of the common things with atelectasis is a dry cough. Signs of restrictive disorder on PFTs, so like we talked about, when the lungs can't expand like they need to, then your flows will be decreased. And lung scarring, on chest x-rays and CTs and stuff like that, it'll show that there's some scarring from the rheumatoid arthritis. Radiology. Whenever you get a chest x-ray or CT scan on somebody with rheumatoid arthritis, it is affecting their lungs. You can see some pleural thickening, a pleural effusion, which is most commonly unilateral, so that means just on one side. So you might see some nodules, which that could maybe be like a clump of those immune cells. And then you obviously might see some skeletal changes, just like we talked about in, the joints of the fingers. Rheumatoid arthritis can affect the joints of the chest. So you might see some erosion of the clavicles and some superior rib notching. Treatment for rheumatoid arthritis, corticosteroids. So you might give a patient an aerosol treatment with Pulmicort. Oxygen therapy, that would be because, like I said, if those alveoli can't expand to what they need to be, then they're unable to get the oxygen that they need to get. So we might treat the patient with some oxygen, especially if they're short of breath or something like that. Another thing would be some immune suppressing drugs, and that would be something that we would not administer, but that would be something that the patient might be on, which could affect our line of work when it comes to, if you think about, if you're suppressing the immune system, then say the patient, gets a cold or, some sort of infection, well, they have less fighters to go and fight that off. So they might be more susceptible to pulmonary infections. So we may need to do some extra bronchial hygiene with them, like a chest vest or flutter valve, or just some, encourage deep breaths and coughs and stuff like that. And here are my references.